Welcome to BoxedIn Health, where knowledge and wellness converge, sparking transformative journeys to a better you. Today we uncover the topic of acne. Acne is a skin issue that happens when your hair follicles get clogged with oil and dead skin cells, resulting in whiteheads, blackheads, or pimples. It's something that a lot of teenagers experience, but it can affect anyone, no matter their age. Luckily, there are effective treatments for acne, although sometimes it's persistent. Those pesky pimples and bumps take their time to heal, and just when you think one is on its way out, a new one pops up. Depending on how bad it is, acne can really get you down emotionally and leave scars on your skin. Getting treatment early on can reduce the chances of dealing with these issues later. The signs and symptoms of acne presents based on how severe your condition is. 1. Closed plugged pores, whiteheads. 2. Open plugged pores, blackheads. 3. Small, red, tender bumps, papules. 4. Pustules, pimples, which are papules with pus at the top. 5. Large, firm, painful lumps under the skin, nodules. 6. Painful lumps under the skin filled with pus, cystic lesions. Typically, acne shows up on the face, forehead, chest, upper back, and shoulders. Acne is basically caused by 4 main things. 1. Making too much oil, sebum. 2. Hair follicles getting clogged with a mix of oil and dead skin cells. 3. Unwanted bacteria. 4. Inflammation. You'll usually spot acne on your face, forehead, chest, upper back, and shoulders because these spots have a bunch of oil-producing glands. These glands are linked to your hair follicles. Sometimes, the walls of these follicles can swell up and form whiteheads, or if the plug is exposed to air, it turns dark and becomes a blackhead. Even though blackheads may look like dirt, they're actually clogged with bacteria and oil. Pimples, those raised red spots with a white center, pop up when blocked hair follicles get all inflamed or infected by bacteria. Deeper inside your follicles, blockages and inflammation can create those painful, cyst-like lumps under your skin. The sweat gland openings on your skin usually aren't part of the acne scene. Certain things can kickstart or worsen acne. 1. Hormonal shifts, like during puberty or even later in life, especially for women. 2. Specific medications, such as ones with corticosteroids, testosterone, or lithium. 3. What you eat might play a role too. Some studies hint that certain foods, especially carb-loaded ones like bread and chips, could make acne worse. More research is needed to be sure. 4. Stress doesn't create acne, but if you're already dealing with acne, stress can crank it up a notch. If you have darker skin, you're more likely to face these acne-related issues. Scars. Acne scars can leave lasting marks like pitted skin or thick scars called keloids. Changes in skin tone. Once the acne is gone, the skin in those areas may be darker, hyperpigmented, or lighter, hypopigmented, than it was before the acne appeared. There are several things that can increase your risk of dealing with acne. Age. Anyone can get acne, but it's a rite of passage for most teenagers. Hormonal roller coasters. Hormonal changes during puberty or pregnancy can really stir up the acne pot. Family tree connections. If acne runs in your family and your parents had it, chances are it's knocking on your door too. Skin breeze fest. If your skin gets cozy with oily stuff like lotions or creams, acne might just crash the party. Skin friction and hugs. Anything that likes to rub or press against your skin, like phones, helmets, tight collars, or backpacks, can stir up trouble. Home remedies can also work well. If you're dealing with acne, you can kickstart a DIY skincare routine to bid it farewell by gently washing your face once a day with lukewarm, not scalding, water and a mild cleanser. These cleansers are the skincare goodies you find at the store to help keep your skin clean. Giving your face a good wash after sweating it out during a workout or on a hot day. Steering clear of skin products that throw a party with alcohol, astringents, toners, or exfoliants. They can really annoy your skin. Wiping off that makeup before hitting the sack or whenever your day ends. Picking a moisturizer that's friendly with oils, to slap on after your wash. Hands-off policy. No popping, picking, or squeezing your acne. Let your skin do its healing dance and avoid those nasty scars. If your DIY skincare groove isn't cutting it, it might be time to pay a visit to a pro in the health department. When you see a healthcare provider for an acne checkup, they'll give your skin a good once-over to understand what's going on. They'll dig into your symptoms and ask about things that could up your acne risk, like how's the stress level in your life? Does acne run in the family? Do breakouts happen around your menstrual cycle, if you're a woman? What's in your medication lineup? The cool thing is, diagnosing acne usually doesn't require any special tests. However, if your acne suddenly goes into beast mode or if you are all grown up and still battling acne big time, they might run some tests to rule out any hidden issues. If those store-bought acne fixes aren't doing the trick after a few weeks, it's time to have a chat with your doc about stronger prescription options. A dermatologist can hook you up too. Get a grip on that pesky acne. Keep your skin safe from scars and other trouble. Minimize the visibility of any scars you might already have. Prescription acne meds usually do their magic by taming oil production, reducing swelling, or fighting off bacterial invaders. But hey, patience is key. With most prescription acne treatments, you might need to hold tight for 4 to 8 weeks before seeing the glow up. And sometimes, it takes several months or even years to fully kick acne to the curb. The treatment plan your doc suggests will totally depend on your age, how bad your acne is, and how dedicated you are to the battle. This might mean twice daily skin cleaning and medication applications for a few weeks or more. Often, it's a combo of creams or gels and some pills. Now, if you're rocking a baby bump, the choices are a bit limited because of potential side effects. Always have a good heart-to-heart with your doc about the pros and cons of any treatments you're considering. And keep those check-ins happening every 3 to 6 months until your skin gets its groove back. The most common topical prescription medications for acne are retinoids and retinoid-like drugs. Drugs that contain retinoic acids or tretinoin are often useful for moderate acne. You apply this medication in the evening, beginning with 3 times a week, then daily as your skin becomes used to it. It prevents plugging of hair follicles. Do not apply tretinoin at the same time as benzoyl peroxide. Topical retinoids increase your skin's sun sensitivity. They can also cause dry skin and redness, especially in people with brown or black skin. Adapalene may be tolerated best. Antibiotics. These work by killing excess skin bacteria and reducing redness and inflammation. For the first few months of treatment, you may use both a retinoid and an antibiotic, with the antibiotic applied in the morning and the retinoid in the evening. Azelaic acid and salicylic acid. Azelaic acid is a naturally occurring acid produced by a yeast. It has antibacterial properties. A 20% azelaic acid cream or gel seems to be as effective as many conventional acne treatments when used twice a day. It can also be used to manage discoloration that occurs with some types of acne. Side effects include skin redness and minor skin irritation. Salicylic acid may help prevent plugged hair follicles and is available as both wash-off and leave-on products. Studies showing its effectiveness are limited. Side effects include skin discoloration and minor skin irritation. Dazone 5% gel twice daily is recommended for inflammatory acne, especially in women with acne. Side effects include redness and dryness. For moderate to severe acne, you may need oral antibiotics to reduce bacteria. Oral antibiotics should be used for the shortest time possible to prevent antibiotic resistance. And they should be combined with other drugs, such as benzoyl peroxide, to reduce the risk of developing antibiotic resistance. Severe side effects from the use of antibiotics to treat acne are uncommon. These drugs do increase your skin's sun sensitivity. 4 combined oral contraceptives are approved by the FDA for acne therapy in women who also wish to use them for contraception. Common side effects of combined oral contraceptives are weight gain, breast tenderness and nausea. These drugs are also associated with increased risk of cardiovascular problems, breast cancer and cervical cancer. Anti-androgen agents. The drug spironolactone may be considered for women and adolescent girls if oral antibiotics aren't helping. It works by blocking the effect of androgen hormones on the oil-producing glands. Possible side effects include breast tenderness and painful periods. Isotretinoin is a derivative of vitamin A. It may be prescribed for people whose moderate or severe acne hasn't responded to other treatments. Potential side effects of oral isotretinoin include inflammatory bowel disease, depression and severe birth defects, so they'll need to see their doctors regularly to monitor for side effects. Some folks find the following treatments helpful, either on their own or in combo with medications. Light therapy. There are different light-based treatments that have shown promise. You'll need to drop by your doctor's office a few times for these. We're still figuring out the best way to use light, which type works best, and how much is just right. Chemical peels. Ever heard of a chemical peel? It's like a skin refresh. They dab on a special chemical solution, like salicylic acid, glycolic acid, or retinoic acid, a few times. It's a good option for milder acne, giving your skin a temporary glow up. But to keep that glow, you'll need a few repeat sessions. Popping and draining. Sometimes, your doc might use special tools to gently get rid of those whiteheads, blackheads, or stubborn cysts that don't budge with creams. It's like a quick fix for your skin, but it might leave a mark. Steroid shots. When those lumps go deep, like nodules and cysts, a steroid shot can save the day. It's like a superhero punch for the pain and swelling. But, fair warning, it can also make your skin a bit thinner and change its color in that spot. If your kid is dealing with acne, reaching out to a pediatric dermatologist is a smart move. You'll want to chat about which medications to steer clear of when it comes to children, finding the right dosages, any potential drug interactions, possible side effects, and how the treatment might influence your child's growth and development. If you liked today's video and want more amazing content like this, don't forget to like, share and subscribe. Thanks for watching. See you again with another video.